A diamond BLACKFAN anemia is an hematologic disease. Look at this picture, shows that signs and symptoms and blood test for diagnosis and disease mechanisms. A detail going on. Introduction. Diamond BLACKFAN anemia DBA is a rare congenital disorder characterized by a failure of the bone marrow to produce red blood cells, leading to severe anemia. First described in 1938, it is named after the physicians Louis K. Diamond and Kenneth BLACKFAN. DBA primarily affects children but can persist into adulthood, requiring lifelong management and care. Etymology. The term diamond BLACKFAN anemia originates from the two physicians Louis K. Diamond and Kenneth D. BLACKFAN, who first described the condition in 1938. The word anemia comes from the Greek and meaning without and haima, meaning blood, reflecting the disorder's hallmark features of reduced red blood cell production. A definition. DBA is a genetic disorder marked by red blood cell aplasia, congenital anomalies, and an increased risk of malignancy. It is classified as a bone marrow failure syndrome and has a strong association with mutations in genes involved in ribosomal protein synthesis. Types. DBA can be classified on genetic mutations. 1. RPS 19 related DBA. The most common type caused by mutations in the RPS 19 gene. 2. Non-RPS 19 DBA include mutations in other ribosomal protein genes such as RPS 24, RPLS, RPL11 and others. 3. Unknown etiology. Causes where no genetic mutations have been identified. Causes. The primary cause of DBA is genetic mutation affecting ribosomal protein genes, leading to impaired ribosome biogenesis and subsequent disruption in erythropoiesis. DBA can occur due to 1. Inherited mutations, autosomal dominant inheritance in most cases. 2. De novo mutations, spontaneous mutations not inherited from parents. Risk factors. 1. Family history. A patient with DBA increases the risk of inheritance. 2. Genetic predisposition. Mutations in specific ribosomal protein genes. 3. Ethnicity. DBA is observed globally but may have a slightly higher prevalence in certain population. Complications. 1. Severe anemia requiring frequent blood transfusions. 2. Iron overload due to repeated transfusion leading to organ damage. 3. Growth retardation and developmental delays. 4. Increased risk of malignancies such as leukemia and osteosarcoma. 5. Congenital abnormalities including corneofacial malformations, heart defects, and thumb anomalies. Pathophysiology. Mutations in ribosomal protein genes disrupt ribosomal assembly and function, leading to increased apoptosis in erythroid progenitor cells. This results in a significant reduction in red blood cells production. Secondary effects include activation of P53 pathways, further contributing to bone marrow failure and developmental abnormalities. Here is step by step outline of the pathophysiology of diamond BLACKFAN anemia. 1. Genetic mutation, first step. Second, ribosomal dysfunction. 3. Activation of the P53 pathway. 4. Erythropoiesis failure. 5. Secondary effects reduce the red blood cells count leading to hypoxia and increased erythropoietin production. Despite elevated erythropoietin, red blood cell production remains insufficient due to the intrinsic defects in progenitor cells. 6. Associated physical features. Defective ribosomal protein function may also impact other developmental processes, explaining congenital abnormalities. Example, corneofacial, lymph or cardiac defects, commonly seen in DBA patients. This cascade highlights the central role of ribosomal dysfunction and p53 activation in the development of the disorder. Signs and symptoms: 1. Pallor and fatigue due to anemia. 2. Failure to thrive in infants. 3. Short stature. 4. Physical anomalies: cleft palate, microcephaly, abnormal thumbs. 5. Increased susceptibility to infections. A diagnosis: 1. Complete blood count CBC reveals microcytic anemia with reticulocytopenia. 2. Bone marrow biopsy shows a reduction in erythroid precursors. 3. Genetic testing identified mutations in ribosomal protein genes. 4. Physical examination detects associated congenital anomalies. 5. Family history helps in identifying inherited cases. Nursing diagnosis: 1. Impaired gas exchange related to decreased oxygen carrying capacity. 2. Risk for infection due to immunosuppression. 3. Delayed growth and development related to chronic illness. 4. Risk for caregiver role strain due to the demand of long-term care. 5. Anxiety related to chronic disease management and prognosis. Management: first, medical management. 1. Blood transfusion to maintain adequate hemoglobin level. 2. Corticosteroids stimulate red blood cell production in responsive patients. 3. Iron chelation therapy prevents iron overload from repeated transfusion. 4. Stem cell transplantation, a curative option in eligible patients. 5. Monitoring for malignancies, regular screening for early detection. Nursing management: 1. Administer blood transfusions and monitor for reactions. 2. Educate families about iron chelation therapy and adherence. 3. Monitor growth and development milestones. 4. Provide emotional support and connect families to support groups. 5. Encourage regular follow up and compliance with treatment regimes. Treatment options: 1. Pharmacological corticosteroids and iron selectors. 2. hematopoietic stem cell transplantation. For severe transfusion dependent cases, 3. Supportive care, blood transfusions, and management of complications. 4. Gene therapy, experimental approaches under investigation. Psychosocial medicine. 1. Counseling, provide psychological support to patients and families. 2. Support groups, connect families with others facing similar challenges. 3. Educational interventions, inform schools about the child's needs. 4. Stress management, techniques for caregivers and patients. 5. Empowerment, encourage participation in decision making and advocacy. Prevention. 1. Genetic counseling for families with history of DBA. 2. Prenatal screening in high risk cases. 3. Early detection and management to prevent complications. In conclusion, diamond BLACKFAN anemia is a complex disorder requiring a multidisciplinary approach for effective management. Advances in genetic research and therapy hold promise for improved outcomes. Comprehensive care, including medical, nursing, and psychosocial support, is essential to enhance the quality of life for patients and families. Thank you. Have a nice day.